G'day guys, Darcy here and Ninja's calf and Achilles. All right, today we're talking about Achilles pain. So if you've got sharp, uncomfortable pain at the back of your heel, it could be your Achilles. It might just be tight tendons around it. It might be your gastroc, it might be your soleus. I'm gonna show you what these muscles are. So here, underneath is our soleus. That one there, look at that. So that comes all the way down the bottom here and then comes out into the lateral part of our calf here. So that's a layer back from our gastroc. When we add another layer, this app's really cool. You can see our gastroc there. So our two heads, which up here on Ninja, 1, 2, look at those big calves, beautiful. And then when we come back, look at that Achilles tendon. So it starts all the way up here and comes into there. So one thing that I wanted to talk to you guys about, and I think I spoke about it in our previous video with Jace when we were talking about IT band syndrome, was when you are running, when you're jogging, it's about 2 to 3 times the force of your body weight that you're putting through that tendon. Sprinting is up to 6 times. So if you're 100 kilos and you're sprinting, you're putting up to 600 kilos through that tendon and your knees and your hips. I mean, our body absorbs the forces evenly. Well, it's meant to if we're running biomechanically sound. But if we're not, we're putting a lot of forces through there. Now, the reason I've got Ninja standing up is you can see the load, the stability that it requires in our Achilles tendon when we're standing. Yeah, so there's a lot of force. Ninja's what, 75-ish kilos? Yep. So 75 kilos being put through a lot is our Achilles. Yeah, one muscle that we don't really switch off when we're walking, when we're standing. You know, that's somebody that's at an office job. That's somebody that's just walking in, that works in retail. That's somebody that works in at the cafe. You're constantly on your feet. You know, you're a chef or something. You're on your feet. Us here, there's a lot of strain, a lot of force put through that tendon. So sometimes you get irritation, pain, discomfort right in that area. What we need to do is learn to transmit those forces. Get into the gym, strengthen that Achilles, strengthen your calves, strengthen your feet, strengthen your knees, your hips, and up the chain. But also, sometimes what is really important is the deep tissue work, the body work, offloading that stress. There's sometimes irritation in there that's causing fragments to peel off, and those tendons start to become like frayed, and that's when you start to feel that pain in there. So let's lie face down. So Achilles tendon pain, I see a lot of it, and now that he's lying there, look how much softer and more supple that is. So there's no load, there's no stress, there's no force being put through that at the moment. So it's really easy to treat. So what I like to do, you saw on that anatomy chart, is the Achilles tendon starts up under the gastroc, comes all the way into the calcaneus. So the calcaneus is that heel bone. So what I like to do is have a little bit of a connection straight into that there. So use my thumb and start to mold and shape and loosen off that quite tense and solidified tendon. So just pushing into the back of the heel. Simple enough. Start to work different angles and start to feel where the tension and the tightness and build up really is. So these insertion points are really important because essentially think of a really tight rope or really tight band, how that might cause friction into this heel. And sometimes our Achilles pain is in the calcaneus and it's actually into this area. So what I like to do is just push into that, or I can start to feel, sometimes you feel little bits of fragments of calcium spurs and built up collagen around that area that's not serving us, and it's actually getting in the way and it's causing some irritation on those attachment sites. So clearing those, cleaning them away, scrape away the barnacles. You're like filing away it's like filing your nail, but the bone. We're filing away that build up, that excessive calcium. So have a little bit of a feel in there. Good. And working that. So you can spend a bit of time doing that. What I also like to do is I've got some wax, not a whole lot, come back and then reverse back into that with my palm. So I'm pushing back in there. Good. So I'm really getting that whole portion of that tissue. So getting the whole Achilles, and then I'm working up. Sometimes it's as simple as treating the gastroc, so the calf, and the soleus, and that's going to relieve some of that pressure. Essentially, that's what it is. It's just pressure that we're putting through that joint or through that attachment site that's causing sharpness with every step, or sharpness when you're in the gym, or sharpness when you're running, playing your sport. And there were probably signs and indications leading up to this before it turned into being sharp. It might have just been that you had tight calves. Your calves were sore and tight, and maybe they were starting to cramp in footy. Maybe you were noticing some soreness in your feet after a big day at work. Those signs, that's the smoke before there's, that's the alarms going off telling you that there's something going on, and we've got it before it turns into a real problem, an injury or a rupture. So working through the gastroc, just using my palm, I'm basically just warming up the tissues, feeling for any adhesions, any blockages, working all the way up behind the back of the knee. It was interesting to look at the soleus as well, because a lot of people, when you look at the anatomy, you think the soleus is just this bottom third, but it attaches right up into the, the head of the tibia. So these broad strokes, they're deep enough to be effective. Yeah, they feel nice. Just get some blood flow through there. We're just plumbers here, plumbing away, getting some circulation through there, getting a rejuvenated blood supply that's essentially delivering all the good stuff, all the nutrients, all the vitamins, all the minerals that our body needs to heal. And sometimes without the body work or the treatment, our body just doesn't get that same circulation through there. So the Bodywork really fast tracks that and progresses that for us. So all the way out the lateral head of the gastroc, you can start to feel, even up here, I'm just starting to feel some knots. So I'll push into those and release them, because those little knots, those little speed humps are essentially like a ripple in the tissue. They're slowing down the activation of that muscle, so that might be implicating the way that our muscles contract and soften and take on the shock and the absorption of the running, the sprinting. As I said, 6 times your body weight through your tendons, through your muscles, through your joints when we're sprinting. That's a lot. So if you're not taking care of yourself, getting a service, the Achilles, as I said, it's one of those muscles you can't just switch off when we're standing. It is always on. So it's always a nice muscle to just nourish, get in there, do some body work. You can do this at home with your partner. You can get on a foam roller. You can get on a massage ball. But the best thing you can do is come in here, get a treatment from one of our practitioners and loosen it off, because it's it can be a really simple fix, but if you let it go on and it turns into more of a tendinopathy, and it's something that you've had for 6 to 8 weeks and you've let it linger, it's probably going to take a little bit longer. You're probably going to need longer rest, which means you're going to miss out on more sport or more gym, more running. So get it early. I guess what I was getting at earlier was, there's signs, there's tightness, there's build-up, there's pressure, there's strain that your body made you aware of weeks ago. Get on top of it. Stretching isn't going to do it either, because the tendon is that white matter and it's that tendinous tissue. It doesn't really stretch well. The fascia that overlays this area as well doesn't stretch well. So the body work is by far a much better modality. Yeah, so stretching is going to help a little bit, but it's just going to be temporary relief in comparison to something that is more long-term. So I'm just having a little bit of a feel through there. You can start to feel different layers of muscles. So you could see the soleus was underneath the gastroc. You can see the Achilles attaches into the gastroc, but then even through there, we have our tibialis posterior. So sometimes a really tight tibialis posterior, which is a muscle on the medial part, can be causing high arches in your foot, which means maybe your joints in your foot aren't articulating well, and therefore each time we walk, we're not really softening the load, and it's quite forceful, quite abrasive, quite stern. So essentially we want to be able to walk gracefully, walk like a ninja, walk soft, and not so heavy-footed, not too hard on your heel. You know, we want to be able to transmit the forces evenly through our tissues, and making sure that our muscles are nice and soft and supple and released, and not really short and tight and angry, is really important when we're considering pure biomechanics. So working through there, and I'm just treating Ninja like a normal client, and I can feel that through the medial side there's some tightness, and I'm just softening that off. You know, we're not actual. I'm not YouTubers. I'm not like a video. What's the right word that I'm trying to think of here? I can't. I'm getting to it. See, I'm a body worker. I make mistakes. I can't even think of what I'm trying to say. Content creators, you know, we do it to educate, sometimes for a bit of a laugh, but yeah, we also just want to get it out to you guys, give you something that's valuable, that you guys can take with you and go, oh yeah, that's what I've got. I can learn from that. I've got a better understanding of it. But day to day, I'm treating real life clients. But I guess there's more of you out there that can watch this, the better. Giving Ninja a bit of curry in here. There's a bit of spice. Okay, going to show you some different ways of treating it. I'm just going to grab this. So you can pinch it, and Ninja's got a really healthy Achilles. What you feel when you've got like Achilles tendonitis and things like that is the sheath of this layer starts to thicken, and it becomes really sensitive and sore. And sometimes pinching that and trying to just melt away what's built up around that area by using this pinch technique is going to really help to dissolve the hardness and create some flow in there. So just showing you different ways. You know, we can grab it like that. Beautiful. Ninja's Achilles have been pretty healthy, touch wood. Geez, you really wouldn't want to rupture your Achilles, and I'm sure some people have had it out there. We've had a guy that works for us that's done his. I've seen him in the past. They're pretty abrasive scars too. So elbow, really broad, pushing down, and then slowly working up. Nice. So making sure you're doing a really thorough job. It's a really comprehensive treatment, you know. It's like hitting the soleus, hitting the Achilles, working on the calcaneus where the Achilles attaches onto, and just having a really good understanding of all these different layers, and the anatomy is really cool, but also knowing a few different techniques and ways to target. Cool. So working up into our money spot here, which is just about there, which is where you saw earlier, those big gastrocs, the two gastroc muscles, meet our soleus and our Achilles tendon. So just sitting on there and holding it. I'll show you from that side. So getting the elbow, this is where you'd want to put your massage ball and just maybe do some dorsiflexion and plantar flexion, sitting on your bum, having a little go at it. Really good. So having a little bit of feel of that calcaneus, maybe getting some movement in there as well, out there. But all in all, that's a pretty good little video on how we can treat the Achilles, fast track it. Yeah, work up the chain. Maybe we need to go into the shin. Maybe there's some tightness in the tib post. Maybe it's the ankle that's really stuck and not moving well. Maybe you need to just get into some barefoot stuff and start to walk around on some grass and some sand and some dirt, and start to understand how you're meant to walk, you know, not be so heel heavy, not be so abrasive, not be so so disturbing of all your tendons and ligaments by landing too forcefully. So there's some things that we can save and talk to you about when you come in and get your treatment. But if you enjoyed that, make sure you do like, subscribe, head to our Patreon for more exclusive content. Yeah, we love you guys. So thanks for watching. We'll see you soon.